With us now, North Dakota Democratic Senator Kent Conrad. He's a member of the Finance Committee where he voted against the public option twice. He is also the chairman of the Senate Budget Committee. And Senator Conrad, thank you so much for coming back to talk with us. What is your point of view on how, if at all, the public option should be represented in this piece of legislation?
Well, I believe there should be a public interest option where there is strong and not-for-profit competition to the for-profit insurance industry.
What does that mean?
That is obviously critically important, but I think it should be done through the cooperative plan, not through a government-run plan. A cooperative plan is run by its members, not by the government, but it is a not-for-profit. That's critically important. And if you look around the world at the systems that work at holding down costs, providing universal coverage, and having quality outcomes at least equal to ours, in some cases superior to ours, that is the model that they follow. It is not the British model. It is a model seen in other places that has been very successful.
Do you get the sense politically that the argument that you just made here will be viable to the extent to which you think a co-op will be part of the legislation?
Well, it is part of the legislation. It came out of the Finance Committee. And let me emphasize another critically important point. Many of the advocates of public option tie it to Medicare levels of reimbursement. My state has the second lowest level of reimbursement in the country under Medicare, and so tying all of our reimbursement to those levels would be a disaster. The major hospital administrators in my state, in every major city yesterday, had press conferences in which they affirmed the point that I have made repeatedly. My state would be very adversely affected by public option tied to Medicare levels of reimbursement. And, of course, that's precisely the formula that came out of the Committee of Jurisdiction in the House of Representatives. That's great for New York, California, Florida. It's very bad for low reimbursement states like mine.
Senator Schumer joined us yesterday and said he was going to push to eliminate that the antitrust exemption that's accorded to health insurance companies, which would create more choices in a lot of states where, again, as I'm sure you know, there are few, if any. Some states, something like 90% of it's only one health insurance company. The other variable is choice. If you were able to create more competitors, more providers by eliminating the exemption, the next phase would then be to create more choices for everybody in a marketplace, the exchange. You know, you're familiar with it. Walk me through your thoughts on the antitrust exemption and then choice.
I think Senator Schumer makes very good points. One thing that is clear, more choice, more competition is a good thing, not a bad thing. For those of us that believe in competition, I come from a very competitive family in sports, and I've always believed competition is a good thing. It's certainly true in healthcare, where most of the markets in the country, over 94% of the markets in this country, are there is not any significant competition.
Would you be so? Does that mean that you were to come to a vote, you would vote to repeal the antitrust exemption?
Well, look, all of this has to be in context. It depends on what is the rest of the package. Do we have something that is coherent? Do we have something that will hold down costs and hold down premiums and expand choice and provide more coverage? I think those are the critical tests, and at the end of the day, we've got to improve quality as well. Yeah,
I agree with you, and I don't know about you, but so far it seems like we've got some distance to cover in terms of achieving some of those goals. To the extent to which you're able to achieve those for us, we are with you all the way, sir. So please get us choice, get us competition, and then come to the taxpayer for subsidies. Don't maintain this old, outdated, broken system, and then come to the taxpayer looking for money, which I know you agree with that.
I could not agree more.
So thank you very much, Senator.